Hi, my name is Dorothy Siqueiros, and I work at San Joaquin Valley Rehabilitation Hospital in Fresno. And I do, again, work in occupational therapy, and I'm currently working in the outpatient services department. So today I wanted to talk to you a little bit about just a brief overview of what a spinal cord injury is and what kind of services we might provide in outpatient occupational therapy. So to start, to review this, the brain and the spinal cord, they work very closely together to control our body functions. So your brain is the main control center, and it sends messages down your spinal cord, which is protected by those bones that go all the way down your back. So the brain sends messages through your spinal cord out to your body to tell it how to move and what to do. And then the messages that come from your body, as far as how hard do I hold something, how quickly do I step, how do I do the things I do, messages come up from the body. If a fly lands on you, you know not to like freak out. But if a fire a piece of spark or something falls on you from a fireworks, you know to move quickly, because the messages from your body go up to your through your spinal cord back up to your brain. And that's kind of how they work. So there's lots of complications that can happen if you have a spinal cord injury. The higher in the spinal cord the injury is, the less messages get out to the body. So you may have a paralysis, you may not be able to move your limbs, maybe your bladder doesn't work right, your bowels don't work right, your breathing isn't quite working right because the muscles have become weak. So as a person with a spinal cord injury goes through the continuum of care, they might start at emergency, right? Save your life, figure out what's going on, get all those services. You move to an inpatient, what we call acute care phase, where you would get medically stable so that you could move on to inpatient rehabilitation services, where the nurses, doctors, therapists, a whole team of people help you to figure out how are you going to get from the hospital now back to your home situation, and how are your caregivers going to be able to help you when you get there. There's so many things to learn. The next step is you go home. They may have helped you figure out how to manage your bowels or your bladder, or work on your strength, try and get the equipment you need if you can't walk anymore to be able to get a wheelchair. So then you go home and you're trying to figure out how to make all these things work. That takes a little bit of time. But once that settles in and you're ready to keep moving, keep getting stronger, moving on to doing more advanced tasks, that's when you come to outpatient services. And in outpatient services and occupational therapy, we can help do lots of things. We can help you to reinforce the information you learn in all those other phases, because it's so much stuff. Some things get forgotten, some things may get missed. We can help to fill in the gaps for some of those areas. We can advance your exercise program so that now that you're getting stronger, we advance the amount of exercise you're able to do. Maybe when you left the hospital, you were so weak you couldn't even move your arms, and now you're able to move your arms, but your hand's not working still. We have special equipment we could teach you to use so that you could feed yourself with the strength you do have. Or you didn't have enough stamina to sit up for more than 20 minutes before you had to go back to bed. Now you can sit up for several hours, and you want to not have a bed bath. You want to be able to get in the shower and get a real shower. We can help you figure out what kind of equipment you might need. Or you say, I got all that personal stuff down, but now I want to do something else. I want to be able to cook. How do I cook from a wheelchair? How do I get to driving? How do I get myself in the car and the wheelchair in the car so that I don't have to have somebody with me all the time? So in outpatient services, we kind of help you get on to those next stages of being able to live with that spinal cord injury and move on to meet other goals that you may have beyond your personal care. So thank you very much for listening, and have a great day.